Thank you, Mr. Chairman. Welcome, Madam Secretary. I've enjoyed working with you during the President's first term, and I'm very pleased that you decided to stay. Others have left, and I'm sure that there are things that might be attractive in leaving, but your willingness to stay and serve the people should be recognized, because this is a very daunting task that you face. Implementing the Affordable Care Act on top of managing Medicare and Medicaid will not be easy. Enrolling millions of people by the end of the year is a Herculean task, which is why the leadership and continuity you provide is so critical. Your experience both as an insurance commissioner and a governor, you know what it's like on the other end, so it's going to be very important to have you at the top talking about what happens. The President's budget really is an effort, in my view, to reinvigorate a search for common ground and the common good. Unlike our colleagues on the other side, the President has been clear about his willingness to tackle the tough issues. Unfortunately, it doesn't mean much when the House Republican leadership refuses to engage in meaningful conversation about shared sacrifice or deficit reduction. You just heard that we're 3 years into this. Well, what they did for the last 3 years was they would not negotiate. And in fact, Republicans have been unrelenting in their zeal to get rid of the ACA, even though it's the first serious and successful attempt ever in this country to curb health care costs. It's projected to reduce the deficit, even with its benefits, by more than $1 trillion over the next 2 decades. Despite 33 House votes for repeal, the Supreme Court ruling, and the presidential election results, their efforts to destroy the law continue. We know they won't get rid of it, and they know they won't get rid of it. John Boehner even said the other day that it's the law of the land. And they also know that there's more than one way to skin a cat. Republicans know that the best way to secure a government that won't tax or regulate them is to create a government that can't do anything. Starve the programs, and the people won't fight for them. Cripple the government, and no one will understand what they need. The sequester cut 8% of the program management budget for CMS, a direct hit to ACA's implementation efforts. It was obvious they did it. Their budget raises costs for current senior citizens by repealing Medicare improvements and ends Medicare as we know it for people nearing eligibility by turning it into a voucher program. Ironically, the CBO says the Republican Medicare voucher proposals would lead to higher national health care spending. We've dealt with access with the ACA. We now have to deal with costs. That's what is the implementation that we're going to be into presently. Their policy is not a clever one. It doesn't lead to better care. It isn't either ethically or fiscally responsible. In contrast, our Medicare reforms in the ACA were based on reality, not red hair. Through our efforts, Medicare's per-person growth rates are historically low and projected to remain so for the foreseeable future. Solvency was significantly extended, new payment and delivery system reforms, which will create a program that favors value over volume and helps drive the right cost, the right care to the right patient at the right time. It hasn't been easy, but that's why I'm glad you're still here. No one is better suited to the job. You understand the importance and the complication of state partnerships, and you're asking for what you need. $1.5 billion to get uninsured Americans health care to establish sustainable spending and tackle the #1 cause of personal bankruptcy. That's a bargain at $1.5 billion. HHS staff are to be commended, especially those at CMS, because they've worked tirelessly to improve changes that overhaul nearly every Medicare payment system. They're creating a whole new infrastructure on the promises of ACA, and they've done it on a shoestring. We know you don't have the resources you need, and the job has been made infinitely harder by false and misleading attacks by opponents. Now, enough is enough. It's time for my Republican colleagues to work with us and the administration to ensure effective implementation of what the American people have demanded, a simpler, more fair health care system that's established by the Affordable Care Act. They had 4 years of advertising against it, and they reelected the president overwhelmingly. because he put it in place. I hope today's conversation is a productive start toward that eventuality and look forward to hear the discussion.
Thank you. Welcome to the Ways and Means Committee, and we have your written testimony.